Your health plan has a number on it called the out-of-pocket maximum. For a marketplace plan this year, it cannot legally exceed about $10,600 for one person. It sounds like exactly what it says, the most you can pay in a year. It is not that, not close. There is a payment most households make every single month that does not count toward that maximum at all. It is usually their largest healthcare cost of the year, and the ceiling was never designed to include it. This is Policy Unpacked. Today, the 4 numbers that decide your share of a medical bill, the 5th number underneath all of them, and where the ceiling actually sits. Scope first. This is about health plan cost sharing in the United States. Plan designs vary enormously. Every figure used here is invented for illustration, and your plan documents are the only authority on your plan. This is not advice about which plan to choose. That depends on your health, your income, the medicines you take, and which doctors are in which network. And none of that is knowable from here. And one more boundary, because this subject attracts it. We are not going to argue about whether American healthcare should work this way or compare it to anywhere else. We are going to explain the machine that exists so you can read your own paperwork. Last time we found the attachment point. That is the threshold. An underlying policy has to cross before an umbrella pays anything. A number that has to be reached before the next layer engages. Hold on to that shape, because health insurance runs on the same machinery, and it runs it more than once. 4 numbers decide almost everything about your share of a medical bill. Deductible, copay, coinsurance, out-of-pocket maximum. The deductible is the amount you pay before the plan starts sharing. At the start of the plan year, for services the deductible applies to, you pay 100% until you have reached it. And there is a detail in that sentence that catches people every year. It resets. Whatever you paid last year does not carry over. On the first day of the new plan year, the deductible is full again, and you are back to paying 100%, which produces the situation everybody has heard about from somebody. Surgery scheduled for December is a very different financial event to the same surgery in January, purely because of which side of the reset it falls on. Nothing medical changes. The arithmetic changes completely. Same machinery as the attachment point, in a different product, a threshold that must be crossed before the layer above does anything. The copay is a flat fee for a specific service, $40 to see a specialist, $15 for a prescription, a fixed amount, not a percentage. The reason copays exist at all is worth 30 seconds, because it explains why they behave differently from everything else here. A copay is predictable. You know before you walk in what the visit cost you, which is the only part of this system that offers that. Everything else on this list is a share of a number you will not see until the bill arrives. And here is where the simple explanations get it wrong. Copays often apply before you have met your deductible, for services like office visits and prescriptions. Often, not always, whether a given copay applies before or after your deductible is a plan design decision, and it varies. Coinsurance is your percentage share after the deductible is met. A plan described as 80-20 means the plan pays 80% and you pay 20%. And the out-of-pocket maximum is the ceiling. Once your deductible, your coinsurance, and your qualifying copays add up to it, the plan pays 100% of covered services for the rest of the plan year. 4 numbers, and they fire in an order. That order is most of what people find confusing about a medical bill. But there is something underneath all 4 that decides what each of them is actually calculated on, and it appears in none of the definitions I just gave you. Here is the question that exposes it. Your coinsurance is 20%. 20% of what? The obvious answer is 20% of the bill. That answer is wrong, and the difference is enormous. Coinsurance is a percentage, but a percentage of what exactly? Of the allowed amount, which is what your plan treats as a reasonable charge for that service. In network, it is typically the rate negotiated between your insurer and that provider. It is not what the provider's price list says. So, an MRI. The facility's list price might be one figure. The allowed amount is what your plan and that facility agreed. If the allowed amount is $1,200, your 20% coinsurance is $240, which means all four of your numbers are calculated against a fifth number that you did not choose, were not told in advance, and had no part in negotiating. Your deductible fills up in allowed amounts. Your coinsurance is a percentage of allowed amounts. Your out-of-pocket maximum is reached in allowed amounts. This is the same shape as File 5, a large number on the cover of a home policy and a smaller mechanism underneath deciding what the check actually was. Here, the mechanism is one layer further down and it is doing even more work. And now, the part that matters practically, because the allowed amount cuts both ways. In network, a negotiated allowed amount that comes in below a list price is working in your favor. The list price is not what anyone pays. Out of network is where it turns. If a provider has no agreement with your plan, there is no negotiated rate, and the provider may bill you for the difference between what they charge and what your plan allowed. That difference has a name, and it is the first of two things that sit completely outside your out-of-pocket maximum. The second one is bigger, and you pay it every month whether you see a doctor or not. Let us run a year. All figures fictional, chosen to be easy to follow rather than typical. The plan: $2,000 deductible, 80/20 coinsurance, $40 specialist copay, applying before the deductible on this particular plan, $8,000 out-of-pocket maximum, and a premium of $400 a month. February, a specialist visit. The copay applies, so the payment is $40. April, an MRI, allowed amount $1,200. The deductible has not been met, so this one is paid in full. $1,200, and the deductible now has $800 left in it. September, surgery. Allowed amount $20,000. And notice that the hospital's own charge for this may have been considerably higher. That number is not in this calculation anywhere. Only the allowed amount enters the arithmetic, which is the fifth number doing its work in the most expensive event of the year. Watch the order, because this is where every confusing bill comes from. The remaining deductible goes first, $800. That leaves $19,200 of allowed amount. Coinsurance applies to that at 20%, $3,840. So add it up. 40 plus 1,200 plus 800 plus 3,840, $5,880. The out-of-pocket maximum is $8,000. This year did not reach it, despite including major surgery. And notice what the plan would report about this year. It would say the member paid $5,880 and did not hit their maximum. That is accurate, and it is not what this household paid. 12 monthly premiums at $400 is $4,800. The real total is $10,680, nearly double what the plan measured, and every dollar of the difference is invisible to the out-of-pocket maximum. And run the same year for a household that needed no care at all. No deductible spent, no coinsurance, out-of-pocket total, $0. Their actual healthcare cost for the year was $4,800, and the plan's own measurement of what they paid is nothing. Both of those statements are correct, which tells you how much work the phrase out-of-pocket is doing. And one practical consequence of the fifth number that is worth having. When a hospital sends you a figure before your insurer has processed the claim, that figure is frequently not what you owe. It is a charge, not a share. The allowed amount has not been applied to it yet, and the plan has not taken its part. Which is why the single most useful habit with medical bills is to wait for the explanation of benefits from your insurer before paying anything. That document shows the allowed amount, what the plan paid, and what is genuinely yours. It is not a bill, and it is the only page in the whole exchange that shows the real arithmetic. This is not an argument that premium should count. They measure a different thing, And the maximum is doing exactly what it says. It is an argument that the phrase means something narrower than it sounds, and that the narrower meaning is the one written into the contract. So what actually counts toward that ceiling? The rule is narrower than the name suggests, and it has 3 conditions: deductible, copays, and coinsurance count, but only for services that are covered, in network and within essential health benefits. Covered, in network, essential. Now the exclusions, and there are 2 that matter. First, premiums do not count, not a portion of them, none. That is not a loophole, and nobody is hiding it. It follows from what the maximum is measuring: your share of the cost of care you received. A premium is what you pay for the plan to exist, whether you use it or not. But the consequence stands regardless of the logic. For a healthy household, premiums are the entire healthcare cost of the year, and the out-of-pocket maximum has nothing to say about them. And for a household with serious ongoing care, the premiums sit on top of the maximum rather than inside it. Those households hit their ceiling and keep paying the monthly amount for the rest of the year, because the 2 are separate obligations that never interact. Which is why the phrase is misleading without being untrue. It is a maximum on one specific category of spending, not a maximum on what healthcare costs you. Second exclusion, out-of-network balance billing. Where a provider charges above your plan's allowed amount and bills you for the gap, that amount does not count towards your maximum either, which produces a genuinely unpleasant combination. The situation where your costs are highest is also the situation where they stop accumulating toward the ceiling designed to stop them. There is one important qualification here, and it has changed in recent years. Federal and state protections now restrict balance billing in particular situations, especially emergency care and certain out-of-network providers treating you at an in-network facility. Those protections are real and they matter. They also do not cover every out-of-network situation, which is why the general rule above still holds. Check what applies where you live before assuming either way. And these are the statutory limits, so know which ones apply to you. The figures that get quoted, around $10,600 for an individual and roughly double that for a family, are the caps for marketplace plans. Employer plans work to their own limits, and every one of these numbers is set annually and revised. Check the current year and check your market. So here is tonight's job, and it is the shortest one this season. Find your summary of benefits and coverage. It is a standardized document, usually a few pages, and every plan has to give you one. Write down 4 numbers: your deductible, your coinsurance percentage, your out-of-pocket maximum, and your copay amounts, noting whether they apply before or after the deductible. The document will tell you, and this is the detail people most often get wrong about their own plan. Then do one piece of arithmetic that no plan document will do for you. Multiply your monthly premium by 12 and add it to your out-of-pocket maximum. That sum is your actual worst case for the year, in-network, for covered services. It is the number people think their out-of-pocket maximum already is, and it is usually thousands of dollars higher. Knowing it does not reduce it. What it does is let you compare 2 plans, honestly, because a lower premium with a higher maximum and a higher premium with a lower maximum are the same trade written 2 different ways, and only the combined figure lets you see which one you are taking. Run it once, and the comparison stops being mysterious. A plan with a low premium and a high maximum is a bet that you will not need much care. A plan with a high premium and a low maximum is the same bet taken from the other side. Neither is clever. They are the same product priced for 2 different guesses about the year ahead, and the combined number is the only way to see which guess you are making. What this will not tell you is which plan to pick. That depends on how much care you expect to need, which is the one variable nobody knows in advance. It is the entire reason this product exists. 8 files, and the pattern was the same in every one. A definition decided whether disability benefits started, and the word was occupation. 3 numbers decided what an auto policy paid, and the middle one was the real ceiling. A landlord's policy covered a building and not the belongings inside it. A valuation method decided whether a check matched the damage. A sequence of steps decided when money arrived and how much of it came in the first payment. An attachment point decided whether a second layer engaged at all. And here, an allowed amount you never see decides what four numbers you do see are calculated against. Every one of those is a boundary, and none of them appear in the marketing, not because anyone is hiding them. They are all printed in documents you already have. They are simply not the part anybody is selling. So if this season has one thing worth keeping, it is a habit rather than a fact. When you look at any policy, do not ask whether you are covered. That question almost always returns yes, and it almost never helps. Ask instead where the coverage stops, what mechanism decides that, and what is standing on the other side of the line. Every episode this season was that question asked of a different product. The answers changed. The question never did. Next season, we go further into the documents themselves and start with the one page that decides more than any other. The one most people have never opened. This is Policy Unpacked. How insurance actually works. No sales pitch.